Regardless of what the federal government's doing, California is the fourth, fifth largest economy in the world. It can and should establish a system of guaranteed health care here.
911, what's your emergency?
America's healthcare system is broken and people are dying.
Welcome to Code Wack, where we shine a light on America's callous healthcare system, how it hurts us, and what we can do about it. I'm your host, Brenda Gazar.
This time on Code Wack, as healthcare costs rise and coverage faces new threats, California advocates are pushing for something bigger than fixes around the edges. We're joined by longtime healthcare organizer Michael Lighty, who breaks down the fight for single payer, what's at stake in 2026, and why unity may be the key to winning guaranteed healthcare for all. Michael is the president of Healthy California Now and has organized, advocated, and developed policy for single payer nationally and in California for more than 30 years. This is the second episode in a two-part series with Michael Lighty. Welcome back to Code Wack, Michael. So tell us about the Healthy California Now Coalition. What is their political agenda in 2026?
Well, Healthy California Now is a coalition of community-based organizations and unions who support a system of guaranteed health care based on single-payer financing and demand an equitable system that addresses the cultural disparities in care and ensures that we all get the health care we need. That coalition broadened our reach to pass SB 770. So we brought in other supporters of healthcare reform into what we call an advocates table. And that broader group really did a lot of the advocacy for SB 770. So what we want to do in 2026 is continue that process. Many of our groups support CalCare, and so we'll be engaged in that fight. And we'll also be wanting to participate in whatever public hearings emerge out of the official report process that the Department of Healthcare Services is delivering to the legislature and whatever public hearings the legislature organizes. And we will be organizing our own stakeholder engagement meetings, maybe on Zoom, maybe in person, but we'll be organizing in support of a single payer healthcare system in California. At the same time, we are setting up a 501c4 where we hopefully will be able to engage in political work in 2026 for the first time to accompany our issue advocacy work. And then, of course, specifically, there's a governor's race. We want to make sure that all the candidates are educated on the importance of establishing a single-payer system in California and that they are prepared to implement such a system when they become governor. So one of our key tasks is, regardless of which governor candidate you may support, make sure that they understand that they need to address the crisis in healthcare that has been exacerbated by H.R. 1 and the cuts to Medicare, and so far the refusal to renew the subsidies under the Affordable Care Act, and say, regardless of what the federal government's doing, California is the fourth, fifth largest economy in the world. It can and should establish a system of guaranteed health care here. And the governor has to lead on that, join Oregon, lead by example, and make a clear contrast between a federal government that wants to really throw people to the wolves in an already rapacious and murderous healthcare system and just say, yeah, you're on your own and good luck, and contrast that to a real, substantive guarantee of healthcare, which is what people expect of government. People want an effective government.
Got it. Can you remind us of the difference between Senate Bill 770 and CalCare?
SB 770 establishes policy principles for a single-payer financing system called unified financing that would guarantee health care to all Californians in consultation with the federal government, and initiates a process to achieve that so that the legislature can approve it and send it to the voters. CalCare seeks to establish a single-payer system through the actions of the legislature and signature by the governor, which would then be presented to the federal government for support. The result of that would come back to the legislature for financing and also ultimately be sent to the voters for voter approval. Both SB 770 and CalCare seek to establish a system that guarantees health care to every resident of California on an equitable basis. And both CalCare and the SB 770 process require legislative legislative approval and require a waiver from the federal government indicating the federal government's support and what they will finance, and ultimately voter approval.
Do you think Senate Bill 770 and CalCare represent different strategies, and can they work together?
I think they represent complementary strategies. I think in this period we can't afford to exaggerate our differences. It is going to require voter approval, and the industry is going to spend $100 million, $200 million against it. So how can we expect to win if we're divided? So what we have to do, I think, is find unity and develop a unified strategy. And so for some of us in Healthy California Now, that may mean being more engaged in the effort to pass CalCare. For CalCare supporters, that may mean let's engage in the 770 stakeholder process to put forward our policy preferences for a single-payer system in California. Because, of course, the 770 process is there to be utilized for advocacy that will go to the legislature. Similarly, the CalCare legislation is there for advocates to say, yeah, that's the policy we want to establish, and the legislature should adopt it. So they don't necessarily have to be in conflict. Now, because 770 it doesn't prescribe anywhere near the level of detail that CalCare does, right? That's one of the strengths. 770 is much more general, sets these principles, so you can fit the CalCare policy into SB 770. What 770 offers is a way to maybe address some of the more politically fraught elements of CalCare and figure out a way to put them in a system design that might have a greater chance politically. But that doesn't mean that they're incompatible. There just may be assessments about what the federal government will support, what the legislature is inclined to do, what the voters would approve. But as someone who worked on prior bills and the initiatives to pass single payer in California going back to 1994, I think we need to do as much organizing work on a unified basis because our ultimate challenge is political. We can work out these policy details, I believe. We can work out the financing because it's relatively easy to finance something that costs less. But really we have to overcome, the industry's political advantage and how they've bought and sold elected officials, how they've dominated the media narrative. And so let's come together and do that. And where there are policy differences, let's figure them out.
Critics argue that state-level efforts are symbolic without federal cooperation. How should people understand that?
Well, Oregon's doing it, right? I mean, on Zoom, I've been at their governance board meetings where they're saying, look, we may not go to the federal government for a waiver for a number of years, but we're going to begin implementing this program in 2028. And that's, of course, subject to legislative and voter approval. So that's real. That's not symbolic. That is building power for sure. And it's going to take further work to secure that federal approval, right? But yeah, the federal government puts, in California's case, over $100 billion into healthcare in California. You're not going to guarantee healthcare to everybody with that federal money. There are a lot of different approaches to do that. You could create a state program that's side by side the existing federal programs. It's not pure single payer in the sense that all the money goes into one pot, then goes out to providers, but can be a system of guaranteed healthcare that adheres to the principles of no financial incentives to deny care, equitable healthcare, getting rid of the commercial entities that, deny us care and prohibit denials of care, prohibit prior authorization, prohibit all those things we don't like in the present system, eliminate the profiteering, eliminate the high administrative costs. There's a lot you can do as a wraparound program, but it's not going to achieve the level of savings, particularly on the administrative side, that single payer would. Obviously, negotiating down prescription drug prices, publicly producing prescription drug prices, establishing rate regulation. All these things are in some form already developing in California, right? We've got CalRx that's producing insulin. We've got OCA, the Office of Healthcare Affordability, setting a budget for health spending in California and specific targets by sector and establishing the rate in which costs can go up on both the hospital side and the insurance plan side. So those are nascent beginning efforts to build the infrastructure for a single payer system. So you have these opportunities within the existing kind of policy framework to make changes that can be building blocks for a single payer system in California.
Under the Trump administration, and with Affordable Care Act subsidies likely ending, should advocates focus on defending existing coverage or pushing systemic change?
As a former colleague of mine at NNU, a nurse leader, used to say, we can walk and chew gum at the same time. So we have to do both. We have to recognize that the Affordable Care Act has saved lives. Yes, it's enriched the insurance companies, but it's made sure that pre-existing conditions and really, what the insurance companies do now is not as bad as what they used to do. And in some ways, by a lot, not as bad. And what they do now is basically in response because they can't do the really horrible stuff that the ACA outlawed. So now they have to find other things that are a little more subtle to deny us care and make more money. And they're bad. And so we need to eliminate those. See, that's why I really object to this political analysis that, all we have to talk about is extending the subsidies. Yeah, so all you have to talk about is expose yourself to the political vulnerability of enriching the insurance companies. I mean, honestly, what do these establishment political consultants think? We're just going to subsidize United Health forever? They're just going to continue to make 75% of revenues from taxpayers? And people are going to be okay with that. Sure, deny my health care, but, take my tax money. I don't see it. Now, okay, political consultants are not known for long-term thinking. It's like, okay, what does it take to win the next election? But the truth is, people are wise to this act. And unless you offer a solution, not just a extension of the status quo, which is better than blowing up the status quo as the president and the Republicans would do, and just literally throw you out there on your own against the healthcare industry. Yeah, that's bad. We should argue against that. But what's the alternative? Is the alternative sufficient unless it guarantees healthcare to everybody and does what every other industrialized country does, as Senator Sanders says, and guarantee healthcare as a right, not a privilege?
Right. For listeners who support Medicare for All, what are the most concrete steps they can take between now and the midterm elections in November?
Well, number one, of course, you have to educate your legislator, both your assembly member and state senator, on the demand for guaranteed health care through single-payer financing. And you have to urge them to support legislation that does that and to support that type of system under the 770 process. For those who have an opportunity to engage in electing a representative in 2026, they need to also support guaranteed health care. And so working on those campaigns that do so, particularly in the primaries, so that that person defeats those who would just fiddle with the present system. That's important. Finding out where the governor's candidates stand, educating them about guaranteed health care through single payer, and demanding that they support that, because that's what we learned. You can't pass single payer in California without governor's support. And a legislature has passed single payer when they knew a Republican governor would veto it. So you're going to have a Democratic governor. And the reason we got as far as we did, though it's not nearly as far as we've wanted, is because Governor Newsom did run on single payer in 2018. Didn't achieve what we wanted or expected, but that's the reason we got as far as we did. And then I think the other piece of it is we have to continue to uplift our stories and our experiences about the inequitable, rapacious healthcare industry. Tell our stories of denied care. Tell our stories of high costs, right? Tell the stories of people with disabilities not being able to get the care they need. Tell the stories of how, because of the reimbursement rates, Medi-Cal doesn't have enough doctors. Talk about the costs associated with not having dental and hearing benefits under traditional Medicare. Talk about the costs and limitations of Medicare Advantage. All these things, that kind of advocacy and public education is important in the service of a political strategy to elect representatives who are going to fight to guarantee us the healthcare we need. And 2026 being an election year, we have to again take advantage of that and do what our movement needs most, and that is engage politically.
Thank you, Michael Lighty of Healthy California Now. Do you love code WACK? Keep us on the air with a tax-deductible donation at heal-ca.org/donate. Do you have a personal story you'd like to share about our WACK healthcare system? Contact us through our website at heal-ca.org. And don't forget to subscribe to Code WACK wherever you find your podcasts. Code WACK's powered by Heal California, uplifting the voices of those fighting for healthcare reform around the country. I'm Brenda Gazar.